Hello everyone, in this video we are going to study the face. So here you have a picture of the face. The face is actually a combination of the soft tissues covering the facial skeleton and the anterior aspect of the skull. And if you consider the layers of this face, the layers are the skin, the superficial fascia, underneath a structure called SMAS, superficial musculo-aponeurotic system, and still deep to it, an extension of the parotidomasseteric fascia. If you consider the skin of the face has different patterns of hair in the male and a very little amount of hair in the female, and it is full of sweat glands and sebaceous glands, and skin texture, skin color, and the skin shows different types of dermatological problems, and the skin is a reflection of the personality of the individual also, because of the different types of emotions it can display by the play of its underlying muscles. Now, in the skin, the features that you can make out over the face are the eyebrows, which are the hairy regions over the superciliary arches, and into these eyebrows are attached the frontal bellies of the occipitofrontalis muscle and the corrugator supercilii muscle and a part of the orbicularis oculi. If you look at the nose, then the shape of the nose and the ala has important bearings in plastic surgery, and between the nose and the cheek over here you have a nasolabial groove or nasolabial furrow followed by a nasolabial fold, and coming out laterally from the nose you have the cheeks, and in the cheeks beneath the skin you have a considerable amount of fat, and anteriorly in front of the masseter and between the buccinator over here and the masseter over here you have a buccal pad of fat. So in the skin you have considerable subcutaneous fat and a deeper level of fat that is more dense, a buccal pad of fat. So the cheek itself contains a lot of fat. Its external lining is the skin and the internal lining is the epithelium of the oral cavity, and in the inner surface of the cheek you have a number of minor mucous glands, minor salivary glands. Now coming down from the cheeks, if you look at the lips and the oral fissure, the bulk of the lips is formed by the orbicularis oculi muscle, and it is contributed to on its innermost surface, the innermost surface of the orbicularis, sorry, not orbicularis oculi, the orbicularis oris. On the innermost aspect of the orbicularis oris you have a muscle called the incisivus. So the incisivus and fibers of the orbicularis oris constitute the deepest layers. In the intermediate layers you have the circular fibers of the orbicularis oris proper, and on a more superficial plane in the lips you have the fibers of the different muscles which are going into the upper and lower lips, like the zygomaticus major minor, levator labii superioris, levator anguli oris, depressor anguli oris, depressor labii inferioris, mentalis, and from below over here the continuation of the platysma, which is the rhizoria. So these form a superficial layer. Now these lips are very vascular structures, and close to the inner mucous lining of the lips you have the main blood supply trunks of the superior labial arteries and the inferior labial arteries. And on the lips what else you can make out is that you have this mucocutaneous junction, and this mucocutaneous junction of the upper lip is given the name of a cupid's bow because it's like a bow, and above the handle of the cupid's bow you have a depression going up to the nasal septum. This depression or groove is called the philtrum, and this mucocutaneous junction of both the upper and lower lips, they are also called the vermilion borders. Now these angles of the lips or the angles of the oral fissures, they are at the level of the first premolar, and the junction line or the point of contact between the two lips is slightly above the bite line, and it is over the maxillary teeth. And if you consider the skin of the face again, the skin of the face, this has these different undulating movements, wrinkles and smooth areas, and these actually conform to certain definite patterns, certain stretch patterns, certain stress lines, and these lines you can make out here. These are the relaxed tension lines of the face, and these are actually seen better during relaxation. So during plastic surgery, incisions and flap reconstructions are preferably done respecting these tension lines of the face. So after this general discussion of the face, we are in a position to go into its details. Thank you.